The first cases in this current outbreak of Ebola were reported last August. That was in the Democratic Republic of Congo. Since then, the World Health Organization has confirmed more than 2,000 victims, and of those, at least 1,400 people have died. That's a 67% fatality rate. Doctors have usually managed to keep it at around 50% and stopped it spreading. But this is the first time Ebola has struck in a conflict zone. The virus causes internal bleeding, and while it's yet to be proven, it's thought fruit bats are the carrier of the virus. Scientists are trying to work out how it jumps to humans, but what is known is how to contain Ebola by quickly and safely burying victims, quarantine anyone who's been near those infected, and vaccinating people. In the early days of this outbreak, the WHO was confident it could contain the virus and resisted calls to declare a global health emergency. The WHO trained hundreds of health workers, equipped them with a containment strategy and a new, albeit experimental, vaccine called V920. The vaccine needed 10 days to kick in and doses were limited, but there was enough to go round if the virus was contained. But it never has been in the DRC. In a climate of ethnic tension and regional conflict, misinformation spread that the Ebola emergency had been manufactured, that the virus didn't even exist. In some areas, people believed the virus was being used by one ethnic group to wipe out another, and others resented the massive resources put into containing Ebola when their basic needs were being neglected. Nearly 200 Ebola clinics have been attacked this year alone. At least 85 health workers were injured or killed. With every act of violence, the Ebola program has been interrupted and the virus has spread. The arrival of Ebola in Uganda realised the worst fears of those dedicated to wiping it out. But what is different in Uganda is that the government's been preparing itself for months, vaccinating more than 4,500 health workers, setting up Ebola treatment centres, and as the first Ugandan victims died, banning mass gatherings and sending in a rapid response team. The lessons from DRC's struggle may enable Uganda to stop Ebola taking hold, but the challenge remains finding a way to stop its spread anywhere else.